Hello, I'm Dhivya Chandrasekaran. I'm a consultant in gynaecology surgery at University College London Cancer Institute. If you're newly diagnosed with ovarian cancer, you may have lots of questions about surgery. We're here to answer some of these for you. Surgery is used to treat ovarian cancer to remove as much of the cancer as possible.
How did you feel about surgery?
I was ready for it. I thought it was such a great landmark. It's a great milestone in your treatment, particularly if you've done chemo first, because it's the moment where you actually get to remove the primary tumours, and that feels so important and so positive. I was tired from the chemotherapy and was glad of the extra week or two of recovery in order to be ready for it. But it felt like a really positive step.
If ovarian cancer is diagnosed early, you may only need one or both your ovaries removed. If your ovarian cancer is diagnosed at a later stage, surgery might involve more than this. It may be that you're not offered surgery at the outset, and this may be because the cancer has spread too far. It's in a place in your body that means it can't be removed safely, or you're too unwell and surgery may be too much of a risk. It's okay to ask for a second opinion if you have concerns about this. You may have surgery alone without chemotherapy, and this may be because the cancer was caught at an early stage. If you do need chemotherapy, you may have surgery first, followed by chemotherapy, and sometimes we offer chemotherapy first, followed by surgery, and then more chemotherapy. So we aim to do surgery within a few weeks after your diagnosis has been discussed in a multidisciplinary team meeting. This involves various cancer specialists, including surgeons, oncologists, radiologists, and pathologists. The timing of surgery also may depend on what other investigations are required, which may mean further scans or sometimes further investigations for your health before undertaking an operation. So surgery may involve just the removal of your ovaries if it was caught at an early stage. If the ovarian cancer has spread to other organs, then it may involve removing your womb, cervix, both tubes and ovaries, and something called the omentum, which is a fatty apron that comes off your intestines. Sometimes ovarian cancer can spread to your bowel, in which case part of your bowel may need to be removed and a stoma brought out.
And I'd been warned at my consultation that I could potentially have to have my spleen removed and my bowel resected, but they wouldn't know. But she was very good at reassuring me. She was like, we could take your spleen out, but it's okay. You don't need your spleen. Or we could do your, resect your bowel, but it's okay. I'll put it back together. So I think that helped, that she was very confident in what she was doing. But again, it was the not knowing what you're going to come out with or without.
My surgeon reassured me that I was going to be okay. He was very comical and very full of life, and I'll never forget him. And he was brilliant. I went into theatre, pre-theatre, and as I was having my epidural and everything else that they do before you go into theatre, he was at the little window waving and clowning around, and I was a little bit scared, thinking, is this guy serious? But he made everything better for me, made it a little bit, not the anxiety. The emotional side was a lot calmer, knowing that he was there and I was in the best hands and he was going to do everything he could to save me.
It is likely that you will be in hospital between 4 to 7 days. Sometimes this may be longer if the surgery has to be more extensive. It takes time to recover following ovarian cancer surgery, and you should aim to rest for 4 to 6 weeks. But everyone is different and recovery times can differ between people.
I think for me, my surgery was in February this year, but it feels like a lifetime ago. And I remember after the operation thinking, I'm not going to be able to walk properly again, because you're just all hunched over and you just feel very fragile, and I just didn't think I would get back to normal. But actually, your body's amazing.
The recovery after surgery was amazing, in the nicest possible way. The specialist nurse were brilliant. They were always there to help me, hold my hand, and kept telling me that you're going to be okay. You'll be a neat again one day. And all the staff were brilliant. You know, it was, I can't believe what I went through. And today I can say that, you know, I can't, you know, such a major thing. And I'm here, and the body is so amazing, how it comes back to normal.
For more information and support, go to targetovariancancer.org.uk.